We're pleased to be joined by Carlos Rodriguez, President and CEO, Community Food Bank of New Jersey. Carlos, good to see you, buddy.
Good to see you, Steve.
Yeah, we're taping on the 10th of May. It'll be seen later. Tell everyone what the Community Food Bank is while we put up your website so people understand the critically important role you and your colleagues play.
So Community Food Bank of New Jersey is the primary provider of food and other services, really to address the growing food insecurity and underlying poverty issues that address the state. We serve 15 out of the 21 counties in our great state of New Jersey.
How bad are things right now as it relates to food insecurity?
Well, the need is not going away. We predicted 56% increase in food insecurity at the onset of the pandemic, and we've seen that reality kind of unfold in communities throughout the state. We're working hard with our local partners, new partners in many cases, and the resources that we've been entrusted with to not only address that immediate need, but also work on the long recovery in front of us.
So when people talk about the New Jersey recovering, the national recovery, the economic recovery, things are better, and they are to a large extent. That does not affect everyone across the board in the same way.
That's true. I mean, let's just put things in perspective. Before the pandemic, we had a thriving economy by many measures, and yet we had just shy of 10% of the population that was food insecure. Since then, we know the economic impact that the pandemic has caused on so many families. We know how many were vulnerable, just barely holding on before the pandemic and became food insecure since the pandemic. And so what that tells us, and what other disasters tell us, like the Great Recession, is that it takes families that have suffered food insecurity during a crisis a lot longer to climb out of that need, despite and even sometimes with the tailwind of a good economy behind them. It's very simple to understand why, Steve. For every month that a food insecure family has been without the resources that they needed to make ends meet, they just have that much more of a financial debt to climb or financial hill to climb out of.
Let me ask you a question. We're doing a series on New Jersey leaders who make a difference, who matter, and you obviously do and have for a long time. But in this space of food insecurity issues, hunger issues, why are you so personally committed to this field?
Well, Steve, I mean, I know this work. I know the results of this work. I know the impact of need. I was born and raised in the South Bronx. I married into New Jersey like the best of us, right? But I know growing up how programs like this have an impact, even before I knew what a not-for-profit was. I know what that worried look on a parent's face is. And I can tell you that as a child, when you realize what that look is, your childhood effectively ends. So I know what this is, and I know the similarities of growing up in a working family, struggling, a working poor family, those episodic needs. I see that. I saw that look so many times. It literally haunts me over the last 12 months. So it's time to really just be honest and be vocal and really double down on what we know can work and should work to make a difference.
Klaus, we've been putting up your website. If people, and again, we're not going to turn this into a fundraiser for your organization, but if people want to, it's money and volunteers. Is that correct?
It's money, volunteer, and your voice.
Explain the voice part.
We need to be able to create awareness around what the problem really is and the fact that many families will continue to be struggling. The spotlight is going to move, right? We're already talking about the recovery, the vaccines, how many shots in arms. So hunger is going to go back to what it was, that behind closed door reality that many working families face. But it's not going to go away. We can't
afford that. I mean, particularly people of color, Black and brown folks are suffering disproportionately with this pandemic and as it relates to food insecurity, correct? How can we be silent? How can we say we're good now?
We cannot be silenced, and we need this voice. We need to be able to talk about our neighbors that are in need, the disproportionately reality that it has on certain populations, Black and brown, absolutely. All the isms that really contribute to the inequities that's a root cause for long-term food insecurity and hunger. We cannot be silent anymore, and I think we need to be much more vocal. And the pandemic has really helped us with that. Because all of a sudden, we saw as a country, as a state, the long lines, and really got to meet our neighbors recognize that it was our neighbors, no matter what community we're in or a part of.
That is Carlos Rodriguez, President and CEO of a terrific organization, the Community Food Bank of New Jersey. By the way, Carlos, you are the largest, but you also help out other food pantries, food banks throughout the state and on the local level, correct?
We are a network of food pantries, soup kitchens, and local emergency food providers. Over 1,000 unique partner programs that rely on our food and other resources. And we are committed to working with them, through them, and making sure that they have what they need to continue in this long road ahead.
That's Carlos Rodriguez. He's a New Jersey leader, an American leader who matters. Thank you so much, Carlos. Appreciate it.
Thank you, Steve.
All the best. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by PSC&G, Hackensack Meridian Health, ADP, Bank of America, Summit Health, Prudential Financial, the Healthcare Foundation of New Jersey, Choose New Jersey, and by Operating Engineers, Local 825. Promotional support provided by NJ.com and by the New Jersey Business and Industry Association.
Hello, this is Dr. Joseph Underwood, emergency medicine physician at Hackensack Meridian Health. Health emergencies don't stop because of the COVID-19 pandemic, so if you're experiencing heart attack symptoms like chest pain or stroke symptoms including balance or vision problems, please call 911 immediately. To learn more about how Hackensack Meridian Health is providing you the best health care during this pandemic, visit hackensackmeridianhealth.org/getcarenow.